Whoa, looking up, does it stress your neck? Well, I used to do a fitness class about 20 years ago for about 6 years, and I cannot tell you how many people said, oh, and I asked them to stretch backwards with the neck, and they would not do it. They said, that is going to hurt your neck. You can get a stroke from it. And I said, okay, and I just let it go. But if you've heard that, and Mike, have you heard this?
I heard that in gym class when I was a kid. We used to do warm-ups one year. We did full neck rotations, looked up. The next year they said, don't rotate all the way back. I was a kid, so I guess I listened. But.
So what we'd like to do is go through this. There really is not a problem with bringing your head back, except for there are potential for having a serious injury with it. So we're going to cover that and get this all cleared up. So I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course, and we want them to, the S word? Subscribe.
Not that S word, a different one. So welcome back to another myth-busting video. We do once a week. We have all different subject matter, and this week it's on can looking up cause strokes?
Well, you said that kind of quiet, Mike. So anyways, what we're going to do is, like I said, there is generally not a problem with it, but there are a small percentage of people that need to be aware if they shouldn't do it because it could cause a problem. And as a therapist, I've done this with many people in the clinic. If they come in and they have symptoms, and typically they're older people, 60 years and older, but it could be younger people as well. So you're not going to look up or stretch your neck if you have any of these symptoms or not diagnosis, but symptoms. Let's go ahead. First one.
So if you have any type of nausea, slurred speech, dizziness, or difficult swallowing, it could be a sign you have some circulation issues going on in your neck to your head.
That's right. Could you grab the spine over there? Because I do want to talk about, there's a term called vertebral.
Well, it's over there.
Oh, sorry. It's called vertebrobasilar insufficiency.
That's
now,
a big word.
There happens to be, can we zoom in on this? There's actually two arteries, and they go through your spinal column. And they're right here and here. There's little holes, and that goes up, and that feeds your brain. And if those become compromised, pinched, or irritated, that can cause a big problem to your brain because it doesn't get appropriate oxygen and blood flow to certain areas, and that's why you get these symptoms that we're talking about. So if you've ever been diagnosed with can you pronounce it for me?
Vertebrobasilar insufficiency, you would not want to do this. Also, if you happen to have a recent stroke or you have known vascular issues, you are going to be more prone to possibly having this happen to you. What are some other things?
Well, a neck injury, for example, whiplash. If you were in a car accident that you really strained your neck, you really need to be careful as well. Any severe neck pain or instability. Now, with instability, you will know it because when you turn your head up and down, you'll feel typically up in the upper part of your neck, it just is not right. It feels like it maybe is moving in there. It can be uncomfortable and painful. Those people that have that, which aren't many, you definitely want to not do this and not look up or stretch your neck. We are actually going to show some stretches that you can do in a safe way, assuming you have no diagnoses or symptoms that we just talked about. Now, there is a test, and I'm going to show you how to do it, how to determine if I was going to have a person work on extension or exercises that are going to get rid of neck pain simply by looking up. And I'll show you that test. It's only to be done by a professional, someone that really knows what they're doing. Even though it looks pretty easy, it is, but you need some experience to be safe with it.
Are you a professional?
Yes, absolutely, Mike. And it may not appear that way, but it is true. Have a seat right there.
Okay, Mr. Professional.
All right. This is the VAT test. It's a vertebral artery test. And again, it's the purpose for it is the arteries that I pointed out here. There's two of them going on each side of the cervical spine. I have the patient sit with good posture, and it typically is not going to be on a stool. It'll probably be on a chair with a backrest so they're more comfortable. And Mike will demonstrate. I'll ask him what to do, and he will demonstrate how it's to be done. Mike, can you look to the right? Okay, now keep that position there and look up towards the ceiling, straight back. Now we're testing the right artery going on that cervical spine. And what I like to be is in front, looking at his eyes, making sure everything, he doesn't have nystagmus or his eyes wiggling back and forth. Do you have any symptoms, any dizziness, anything that feels unusual at all?
No.
Okay, if that's the response, that's good. Then we'll go back to here, and we'll obviously do the other side. Look to the left, and then extend again. And we're going to hold that and go through that again. If that's negative, then I continue on, and I'm not concerned about any exercises or stretching that involve looking up. Again, this is for a professional to do, but just so you have a concept of what's going on with that. All right, you can get up from there, Mike. Now, we have these towels for a specific reason. If you are going to stretch your neck and you want to stretch it right, left, or looking up, just like you're looking up towards the stars because you feel like your neck is just getting tight, the best way to do it is actually take a towel, okay?
Mine's prettier.
Yeah, he's got the nice pretty one. I got the standard white issue one you get from the hospital. And actually, you roll it up however you like, okay? Put it around your neck. And a bigger towel offers more support. So if you get a big bathroom towel, it'll be a little more comfortable. Smaller one, not so much. And then we're simply going to, I'll do it on a chair. Mike can do it seated there, looking forward. If you do want to stretch out your neck looking up, and you don't have any problem with your neck as we've gone over, I like to lean back in the chair so it's more relaxed. You don't have to, especially if you're younger, and hold it, not real tight, just comfortably, and just simply look back and up, and you'll notice this towel, the support from the towel really makes the stretch very much more comfortable than without it. I've done it like this with my hands here, and that works pretty good too. Not near as comfortable as a towel. Oops, and my earpiece is coming off. Mike, you want to talk about rotating right and left?
I can, but you can also work on going lower on your neck as well as higher up when you're doing this one. And sometimes I even like to kind of go up with my hands and just see how that feels. You can just kind of toy around with it and see what feels good. Now for rotation, it's a little more confusing. It's not too bad, but I'm actually going to grab opposite hands. So I'm not going to grab same side, opposite. So I'm going to pull down, grab my left hand here, and then I'm going to rotate to the left like this. Hopefully I'm not hitting my microphone too much here. But notice I'm kind of below my ear here on my jawline. You can go up a little higher. I just have a microphone on right now, so I'm not going to. And you can just kind of rotate. If you want to hold it for 10, 15 seconds, you can. If you'd rather do reps. But this should feel good as long as it's not causing any pain. Okay, now to switch sides, I'm going to reach over with my left hand first, then my right hand, and I'm going to rotate towards the right.
Good. And one thing Mike talked about, I'm just going to emphasize it. You really need to make sure you go up across the jawline. If you bring it down low, you simply choke yourself. That is not achieving the goal. Now, one good example of why you would do this stretch, for example, in your car, particularly if you don't have a newer car where you can look at the backup camera and you need to look behind you to see what's going on either side. Because that is one range of motion as we age. You get over 60, it tightens up notably, and I've seen it time and time again. So it's a really nice, gentle way to stretch so you can look right to left and look behind you a little bit in a situation like that. So I would hold those stretch for 10 to 15 seconds. You can go longer if you want. If you feel any symptoms at all that's not normal, you need to stop doing it. That should feel good. It should be a pleasurable stretch and you get done and everything feels good. If not, then you should hold on it.
So give those a try, and if you want to check out more videos for seniors specifically and stretching, you can click the video link on the screen.
Yeah, 3 basic stretches all seniors should do daily. Better watch that one.